Lilith Dlamini tested positive for the human immunodeficiency virus in 2002. It was a stressful time in South Africa. HIV was rampant and access to life-saving antiretrovirals was limited.
It was difficult because it wasn't available in the public sector. Only people who had medical aid could afford buying antiretroviral treatment. So anyone else who couldn't afford medical aid died due to AIDS-related illnesses.
Getting treatments into the country for over 5 million people already infected was a huge battle. Dlamini was part of a pilot program to test antiretroviral therapy. A year later, in 2003, a comprehensive strategy was introduced, which was a turning point for people living with HIV.
At the time, when you had to start treatment, you needed to have a CD4 cell count of less than 200. But now we have test and treat, where when you're tested today, you're giving antiretroviral treatment today.
The introduction of the ARV program didn't completely halt infections, but it hampered the spread and suppressed the disease for Dlamini and millions of others. Close to 8 million South Africans were HIV positive at the end of 2023. 70% of them are on ARVs with a good quality of life.
People are living longer and they're aging very well. People are not actually sickly as they used to be. All those are the positive things that are contributed towards the enrollment of ARVs in South Africa, or ARVs treatment in South Africa.
Getting the remaining patients on ARVs and keeping everyone on treatment is the biggest stumbling block to eradicating AIDS by 2030.
That for me is one huge challenge that the future of antiretroviral treatment is going to face: disengagement in care and the return of AIDS-defining illnesses to Africa. We need a collective effort from the community, from people living with HIV, from scientists, from program implementers, from policymakers on how we're going to do better at engaging people in care.
The clouds have lifted over South Africa since dark early days of the epidemic, when HIV-positive people fought desperately for the right to live. It still carries the highest disease burden in the world, but the fight now is about ensuring access to innovative, longer-lasting drugs to prevent or make treatment simpler and reduce the risk of defaulting. A battle mirrored by the theme of World AIDS Day 2024, Take the Right Path, My Health, My Right. Julie Shara, CGTN, Cape Town.